As cognitive behavioral coaches, we're right there on the front lines, helping people transform their lives. But that comes with this immense responsibility, right? And probably one of the toughest calls we have to make is figuring out, is my client really ready for coaching, or do they need something more? Navigating that line is absolutely critical. It's about being ethical, keeping our clients safe, and frankly, making sure we're actually doing good work. So, how do we get better at this? Well, that's what we're going to tackle today. We are going to walk through a really simple but incredibly powerful framework to help us make that decision. We'll start with a big question. Then we'll break it all down using a traffic light system: green for go, yellow for caution, and red for stop. And stick around, because at the end, I've got a super practical tool you can start using in your very next intake session. All right, let's dive right in. This is ground zero. Every single one of us has been in that moment, or you will be, where you're sitting with a client and you just get that feeling, that nagging question, am I really the right person to help here? Getting clear on that is our first job. Look, at the end of the day, it all boils down to this one question. Is this person coachable, or do they need clinical support? And let's be real, this isn't just a nice to know. This is our ethical duty. Answering this question correctly might just be the most important assessment we ever make in our practice. So, how do we move this beyond just a gut feeling and turn it into a more structured, confident assessment? Well, that's where this simple idea comes in: the traffic light framework. Seriously, it's such a practical way to get a quick, clear sense of where your client stands, right from that very first conversation. And it's exactly what it sounds like. We've got 3 zones. The green zone, that's our green light, full steam ahead with coaching. The yellow zone is where we need to slow down, pump the brakes, and proceed with a whole lot of caution. And the red zone, that's a hard stop, no questions asked. This is an immediate referral. So let's break down what each of these looks like in the real world. Okay, let's start with the good stuff, the green zone. These are the clients that, honestly, we all hope for. They're in that sweet spot where our coaching skills can make a massive impact because they are truly ready to roll up their sleeves and do the work. So who's in this green zone? We're talking about folks dealing with something specific, something situational, maybe a tough career change or getting over a breakup. They might be feeling stressed or stuck, for sure, but their day-to-day life isn't falling apart. They're motivated, they're talking about goals and growth, and, most importantly, there are no immediate safety concerns. This is our playground. This is where we shine. All right, now for the yellow zone. And this is where things get tricky. This is the gray area. It's not a clear yes, and it's not a clear no. And this is where our professional judgment is truly put to the test. A yellow light means we need to be really, really careful. So what are the warning signs here? Well, we're looking at symptoms that have been hanging around for a couple of months, not just a couple of weeks. Maybe they mention a past diagnosis or that they're on medication. You start to hear how their emotions are really starting to impact their work, their sleep, their relationships. And here is a huge one to watch for: when their goals are really vague. They just want to be fixed. That's a massive clue that there's probably some deeper therapeutic work that needs to happen first. So what's our move in the yellow zone? It's simple. We hit pause. Our top priority is not to jump into setting coaching goals. The best, most ethical thing we can do is suggest they see a therapist. Or even better, see if they're open to us partnering with a therapist. That way, the client gets the full spectrum support they actually need, and we can rest easy knowing we acted with integrity. And now we come to the red zone. Listen, there are no gray areas here. This is a non-negotiable hard stop. In this situation, we have one job and one job only: get the client to clinical care immediately. Their safety is the only thing that matters. What are these red flags? Any, and I mean any, mention of suicidal thoughts or self-harm. Any talk of active substance abuse or an eating disorder. Recent hospitalization, signs of psychosis like hallucinations or paranoia. Our job is not to play detective or therapist. Our job is to recognize the immediate danger and get them to someone who is actually trained to handle it. Let me be perfectly clear. Coaching is completely off the table. We are not equipped for these kinds of acute crises. It is our professional and ethical mandate to make sure they connect with a licensed mental health professional, period. And we don't even think about resuming coaching until a clinician gives us explicit clearance. Okay, so that's the framework. It's great in theory, but how do we actually bring this into an intake session without it feeling like some kind of clinical screening? Well, here is a super simple, actionable tool you can start using tomorrow. It's just one question. You simply ask your client, hey, on a scale of 1 to 10, with 10 being totally in control and 1 being not at all, how in control do you feel of your emotions and stress right now? This isn't a diagnostic tool, it's a conversation starter. It's a quick and gentle way to get a read on their internal state and their capacity to even engage with our coaching process. Now, the number to listen for here is 5. If a client rates themselves below a 5, that doesn't automatically mean they're in the red zone, but it is a huge, flashing yellow light. It's a strong signal that they're likely in that yellow zone, and it means we absolutely need to dig deeper and really question if coaching is the right kind of support for them at this moment. So I'll leave you with this to reflect on. How will this simple framework sharpen your own professional judgment? How can you use these zones, green, yellow, and red, to not only protect your clients and your practice, but to empower you to be a more confident, more ethical, and ultimately a much more effective coach? Think about it.